A formal good evening to everybody and welcome to the college's introductory webinar on our new CIRCL program. We'll begin with a couple of reminders. If you're experiencing any technical issues, please email communications@bcpharmacists.org. Just a quick note that the presentation portion of this webinar is being recorded and it will be shared and posted on our website after this session. If you would like to submit a question, click the Q&A button on the top of your screen in most cases, and we'll be keeping track of the questions, but note that the Q&As will be answered at the end of the presentation. We encourage you to enter your questions as we go along though, and we'll try to get to as many of them as we can at the end. Before we begin, I'd like to acknowledge the rights and title of the First Nations on whose collective unceded territories the Office of the College of Pharmacists of British Columbia is located. These are the homelands of the Hunkaminam-speaking peoples in the territories of the Musqueam and the Tsleil-Waututh Nations, and the Squamish-Snatcham-speaking peoples of the Squamish Nation. These nations have existed here for over 9,000 years, and we continue to support their inherent rights and title to these lands and waters. In recognition of our role in serving people and communities across the province, we also acknowledge the rights and title of over 200 First Nations whose collective unceded territories stretch to every inch of what is now colonially known as British Columbia. As leaders in the settler health system, we acknowledge our responsibilities to uphold the inherent and enduring rights of Indigenous peoples across Canada under international, national, and provincial law. So I'm Ashifa Ketcherjee, Senior Director of the HPOA Transition, and will be presenting on behalf of the college. I'm especially excited as I've been working on this since the college embarked on its journey with medication incident reporting, and it's really nice to see it come to fruition. Our partner on the webinar tonight is the Institute for Safe Medication Practices Canada, or ISMP Canada, and I'm happy to be presenting along with my classmate and good friend from my UBC grad class, Ina Ajala, who I will turn it over to now to introduce herself.
Thank you so much, Ashifa. It's my pleasure to be here today. As the Director of Community Pharmacy Reporting and Learning Programs at ISMP Canada, my role includes working with the pharmacy regulators in each province to support their medication incident reporting programs. I also support pharmacists across the country in learning from each other, and I look forward to sharing with you today what that looks like.
Thanks, Ina. Today, we'll start with an introduction to the CIRCL program, the college's new framework for medication incident reporting in BC. I'll share how and why it was developed, what it's designed to achieve, and the key requirements and timelines for all pharmacies. Next, we'll give you an overview of ISMP Canada, the Canadian Medication Incident Reporting and Prevention System, or CMIRPS, and the two national databases pharmacies will be reporting into: the National Incident Data Repository, or NIDR, for community pharmacies, and the National System for Incident Reporting, or NSIR, for hospital pharmacies. We will then walk through how medication incident reporting works in practice for both community and hospital pharmacies, and how privacy and confidentiality are protected. After that, we'll look at how shared learning happens, how the data is analyzed, the insights it generates, and how those insights are used to improve medication safety. And finally, we'll wrap up with resources to support you in applying these learnings to your own practices. CIRCL is the college's comprehensive medication incident reporting program for all community and hospital pharmacies in BC. In developing CIRCL, the college conducted extensive engagement with our Pharmacy Advisory Committee and key partners, including health authorities, professional associations, and the BC Public Advisory Network, to ensure that the program would be effective and practical to implement. CIRCL is based on NAPRA's model standards of practice, which ensures consistency with national approaches while addressing BC-specific needs. CIRCL is built around 4 elements that work together to improve medication safety in pharmacies. Continuous improvement means regularly reviewing how your pharmacy operates and making changes where needed. Reporting is documenting incidents and near misses in a consistent way so that patterns can be identified. Collaborating brings teams, clients, and other healthcare providers together to share information and address safety issues. Learning is using what we find from incidents to make changes that reduce risk in the future. Together, these 4 elements make CIRCL a clear and practical framework to help pharmacy teams prevent harm before it happens. Medication incidents are a leading cause of injury and avoidable harm in healthcare systems across the world. They represent a major client safety challenge. And here in BC, some of the most common complaints received by the college are related to medication dispensing errors by pharmacy professionals. That's why CIRCL was created, to improve pharmacy services by preventing injuries caused by medication incidents through proactive identification of risks, thorough analysis of incidents, and implementation of effective preventative measures. CIRCL addresses this critical client safety need in 3 important ways. First, it creates a structured and consistent approach to medication safety, so every pharmacy is working within the same framework. Second, it builds on quality management practices that are already in place, giving pharmacies tools to go further. And third, it provides opportunities for systematic learning, not just from serious incidents, but also from near misses, so pharmacy teams can improve proactively before harm occurs. To facilitate this reporting, data collected by pharmacy professionals will be entered into a reporting platform at the pharmacy level and then submitted in de-identified form to national databases. These databases enable the secure collection and analysis of medication incidents while protecting the identities of those involved. The de-identified data submitted to these national databases will be combined with data from pharmacies across the country. This aggregated information will be used to identify national trends, facilitate shared learning, and inform the development of medication safety recommendations. CIRCL isn't just about meeting requirements. It's about making your pharmacy stronger and safer. By providing a structured approach to quality management, the program will help you and your team transform incidents and near misses into learning opportunities, strengthen team collaboration and engagement, build and maintain client trust, access national safety insights and resources, systematically improve accountability, identify and address risks before incidents occur, and above all, CIRCL is about ensuring that every client in BC has a safer, more trusted healthcare experience, regardless of pharmacy setting. The bylaws that establish CIRCL and its standards have now been approved, and a transition period is underway. Full implementation is required by June 1st, 2026. That's the date when all requirements will come into effect for every pharmacy. We recognize that this kind of change takes time, which is why the transition period is in place. But it's important to begin preparing early. The college will be providing resources and education opportunities throughout this period to help you and your team get ready and feel confident by the time the deadline arrives. On the next slide, I'll walk you through exactly what pharmacies will need to have in place by June 1st, 2026. The requirements for pharmacies under CIRCL will include having a compliant reporting platform in place by June 1st, 2026, along with beginning to document all medication incidents with the required data fields, starting to conduct incident analysis and develop improvement plans, and having a process in place for communicating openly and transparently with your clients about incidents. Then, by June 1st, 2027, holding an initial team meeting, which will need to happen at least once a year after that, and completing a safety self-assessment, which will need to be completed every 3 years after that. Together, these requirements are about building stronger systems that support learning, improvement, and ultimately safer care for clients. All CIRCL requirements apply to both community and hospital pharmacies in the same way, with the same timelines. This means the requirements for reporting, team meetings, safety self-assessment, and other CIRCL components must be implemented in both hospital pharmacies and community pharmacies by June 1st, 2026. While you may already be meeting some of these requirements, others will need development, training, and implementation. The transition period gives you time, but you need to start now by identifying those elements and begin making the changes needed. When implemented, BC will be joining 8 other provinces who currently have or will have mandatory medication incident reporting in place, following the same NAPRA standards. CIRCL integrates seamlessly with established databases, and BC's participation will strengthen shared learning across Canadian pharmacy practice while bringing valuable insights back to our province. Before I pass it over to Ina, just a reminder to continue submitting your questions as we move through the presentation using your Q&A function at the top of your screen. Over to you, Ina.
Great. Thank you, Ashifa. Now, a little bit about ISMP Canada. ISMP Canada is a national, independent, not-for-profit organization. For over 20 years, we have been a trusted partner in strengthening medication safety through timely learning, sharing, and acting to improve healthcare. Let's start by understanding a bit more about how we learn. We collect, aggregate, and analyze data on medication safety from practitioners, consumers, caregivers, and others so that this knowledge can be used to understand what issues and errors are occurring with medications and why. With this knowledge, we then develop and disseminate lessons learned with compelling, actionable, evidence-informed recommendations for reducing preventable harm related to medications. This knowledge and expertise is then used to purposefully partner to implement, sustain, and evaluate medication safety improvements in practice. All of this work is in collaboration with organizations, practitioners, consumers, caregivers, and other partners across the healthcare system. So how do we reduce and prevent harm? We learn from the reports shared into the national databases, and through incident analysis, we develop evidence-informed recommendations. More than 430,000 reports of medication incidents have been received by ISMP Canada from healthcare practitioners, consumers, and community pharmacies to inform shared learning. We are working collaboratively to reduce or prevent harm from medication use in Canada. To date, over 200 standards, guidelines, best practices, and required organizational practices have been influenced by or developed with input from ISMP Canada. ISMP Canada is one of the collaborating parties in the Canadian Medication Incident Reporting and Prevention System, or CMIRPS, together with Health Canada, the Canadian Institute for Health Information, or CIHI as you may know it, Patients for Patient Safety Canada, and the Canadian Patient Safety Institute. The goal of CMIRPS is to reduce and prevent harmful medication incidents in Canada. ISMP Canada receives funding from Health Canada for medication safety activities to support the goal of CMIRPS. These activities include the analysis of reports submitted to each of their respective databases, which are the National Incident Data Repository for Community Pharmacies, the Consumer Reporting Program, the Individual Practitioner Reporting Program, and CIHI's National System for Incident Reporting, or NSIR. This analysis facilitates the development and dissemination of timely, targeted recommendations designed to improve healthcare systems and medication safety. ISMP Canada's National Incident Data Repository for Community Pharmacies, or the NIDR as we call it, is a collection of reported medication incidents submitted anonymously by community pharmacies for the purpose of improving medication safety in the community and elsewhere. CIHI's National Incident Reporting System, or NSIR, as we call it for short, has received over 100,000 reports since inception. NSIR enables sharing and learning by giving leaders on the front lines tools, access, and knowledge to implement local solutions. Currently, all acute care facilities in BC and Ontario submit reports into NSIR, along with select acute care facilities in Saskatchewan, Manitoba, Nova Scotia, and Nunavut. NSIR does not collect identifying information for the client or the provider, and ISMP Canada can query NSIR data. ISMP Canada holds the NIDR for community pharmacies. On a previous slide, I shared with you that ISMP Canada has received more than 430,000 reports from healthcare practitioners, consumers, and pharmacies. More than 370,000 of those reports have come from submissions from community pharmacies since 2008, when the database was established. On the next slide, we'll learn more about the NIDR contributing provinces. Currently, provinces with mandatory submission of reports to the NIDR through their CQI programs include Nova Scotia, Saskatchewan, New Brunswick, Manitoba, PEI, and Newfoundland and Labrador. Alberta will begin mandatory submission to the NIDR by February 1st, 2026, and we here in BC will join in June of 2026 as part of the CIRCL program. The Ontario College of Pharmacists has had mandatory reporting in place since 2018. The board has recently approved a motion to update their practice standards to require sharing nationally with the NIDR by 2027. In terms of overall number of pharmacies, There are currently over 1,700 pharmacies across Canada contributing to the NIDR, and once British Columbia and Alberta pharmacies are reporting incidents next year, there will be over 4,700 contributing pharmacies across Canada. With Ontario's proposed implementation by 2027, there will be over 9,700 pharmacies submitting anonymous reports to the NIDR. NAPRA continues to update their model standards that influence a national sector. They agree that provincial medication incident reporting programs contribute to continuous quality improvement and patient safety for all people who live in Canada. To quote the model standards, continuous quality improvement and mandatory medication incident reporting programs provide pharmacy professionals with information and learning opportunities based on meaningful analysis of both pharmacy level and national, provincial, territorial level data, with the goal of reducing the number of medication incidents, mitigating risks to patients, and improving the quality and safety of patient care. ISMP Canada established the Safe Medication Use website in 2010, and it was designed for three purposes. Firstly, to provide information for consumers via newsletters, which are both written and reviewed by consumers. Secondly, it was to collect medication error reports for consumers, which most often determine the content of the newsletters. And thirdly, to share medication safety specific resources like medication recalls and helpful tools and videos. In 2019, with the goal of increasing the quality and quantity of consumer reported medication errors, a pan-Canadian team of consumers and safety organizations came together to develop a new reporting platform. Consumers voiced that there needed to be a user-friendly way to share reports, and thus this year, a new website will be released called mederror.ca. The goals of reporting, sharing, and learning still remain the priority. The new site will also feature stories from patients as well as the impact that consumer reports have made over the years. Now let's learn a little bit about medication incident reporting. You may be wondering, how exactly does reporting work? This graphic helps illustrate the pathways, one for a community pharmacy and one for a hospital pharmacy in BC, to report into their respective national database. On the left here, a community pharmacy wishes to submit to the NIDR. This community pharmacy selects a platform provider of their choosing that meets the requirements of the CIRCL program. One of those requirements is the de-identified submission of medication incident and near miss reports to the NIDR. A data sharing agreement is signed between the pharmacy and the NIDR housed by ISMP Canada. The pharmacy manager denotes their chosen reporting platform provider in the data sharing agreement. And then data is collected through a secure transfer protocol for the purpose of analysis and shared learning to advance medication safety. On the right side of this graphic, we have a hospital pharmacy. In BC, all hospitals or acute care facilities submit medication incident reports through the BC Patient Safety Learning System, or BCPSLS. The BCPSLS is a cloud-based patient safety event reporting, learning, and management tool used by care providers across BC's regional health authorities and the Provincial Health Services Authority. The same steps apply here as well. An agreement is signed between the hospital or health authority to submit to NSIR. At a high level, the pathway is similar for a community pharmacy and a hospital pharmacy. Both have agreements in place with medication incident reporting platform provider, and both submit into a national database, which is part of CMIRPS. Learning from both community pharmacies and hospital pharmacies will contribute to the provincial and national analysis outputs. To help with understanding, let's break that reporting and learning process into a couple of steps. First, let's answer the question, how does information sharing from the pharmacy occur to the respective national database? As noted on the previous slide, this process is very similar for both streams. For community pharmacies, they will select a reporting platform provider that meets the CIRCL requirements, and the pharmacy manager will sign a data sharing agreement with ISMP Canada that allows the platform provider to submit de-identified and near-miss reports to the NIDR. Hospital pharmacies in BC currently share de-identified reports through BC PSLS and similarly have an agreement in place. Both streams do not collect data that may identify an individual or an organization, and they do not collect personal health information. You may have some questions about privacy and confidentiality. ISMP Canada does not require any information that identifies or may reasonably be foreseen to identify an individual, either a client or a reporter. Data is collected through a secure transfer protocol for the purpose of analysis and shared learning. ISMP Canada does not collect data that may identify an individual or an organization. Institutions or pharmacies submitting incident reports are asked to ensure that all identifying information is removed before submission. In our agreements, ISMP Canada requests that all identifying information, both client and reporter, be removed prior to it being shared to the NIDR. ISMP Canada cannot identify pharmacies reporting to the NIDR and can only identify from which province a report was received. ISMP Canada's privacy policy covers situations where identifiable personal information may inadvertently be disclosed in an incident report. ISMP Canada has practices and procedures in place to ensure any potentially identifying information is securely destroyed and the only information kept is de-identified. ISMP Canada only discloses or publishes aggregated information. This means information that is grouped together or summarized, and it is shared in a manner designed to ensure that individuals and institutions cannot be identified. Now, let's continue our understanding by focusing on the learning process. How does information sharing to CMERPs translate back to pharmacy professionals, back to you on the front lines? You've learned about how our different reporting streams from practitioners, facilities, consumers, and community pharmacies that collect tens of thousands of incident reports each year. ISMP Canada's analysis team reviews selected incident reports weekly. The team is comprised of pharmacy professionals, nurses, and prescribers, all with clinical expertise and safety expertise. Our task is to analyze these incidents using a rigorous and validated process for identifying contributing factors and causes. We then develop recommendations, again using a robust framework and informed by evidence. ISMP Canada then works collaboratively with each pharmacy regulator in the province to optimize the information sharing in that province. We then disseminate our findings and recommendations via a number of mechanisms, tailoring our outputs to each of our many audiences. I'll focus on these in the next section of this presentation. So let's talk about shared learning, how the learning gets back to you as pharmacy professionals. Shared learning occurs at a national level as well as at a provincial level. The NIDR National Snapshot is published annually and provides an overview of key trends, insights, and information about medication incidents reported by community pharmacies across Canada. Last year's publication shares key quantitative information. For example, this includes the top 10 drugs causing harm in Canada and the top 3 categories of contributing factors reported to the NIDR. The NIDR provincial safety briefs provide quantitative information reflecting a 6-month medication reporting period. ISMP Canada collaborates with each regulator to provide recommended system safeguards based on trending safety concerns in a province. BC's first safety brief will be published towards the end of 2026. ISMP Canada disseminates lessons learned with compelling, actionable, evidence-informed recommendations across the health system. How do we share this information with you? Through our safety bulletins and alerts. ISMP Canada's safety bulletins and alerts are designed to disseminate timely, targeted information to reduce the risk of medication incidents. Some examples of recent community pharmacy focus bulletins based on NIDR data analysis include the clinical assessment of laboratory data and good catches in community pharmacy settings. Some examples of recent hospital pharmacy focus bulletins based on NSIR and NIDR data analysis include oxytocin overdose risks, elastomeric pump errors, misoprostol dosing, and IV fluid storage. You may ask the question, how has reporting errors made a difference? How could it reduce or prevent harm? On these next few slides, I'll share a few examples of how reporting resulted in a change for improved patient safety. ISMP Canada received several reports, including one about an incident that resulted in client harm, describing an inadvertent 11-fold dosing error with Delorol 1, which is a morphine 1 milligram per ml syrup. The manufacturer, Laboratoire Atlas, was informed of the incident reports. In communication with Health Canada and in accordance with the Good Label and Package Practices Guide for Prescription Drugs, which recommends that numbers without units of measure should not be used to express product strength, the numeral 1 was removed from the name of both products. ISMP Canada is grateful to the healthcare providers and organizations who submitted reports and also appreciates the focus on client safety demonstrated by Laboratoire Atlas. The Good Label and Package Practices Guide for Prescription Drugs was prepared with the collaboration of ISMP Canada and Health Canada with an expert advisory panel. In this second example, ISMP Canada received a report from a parent who purchased the wrong product for their baby. The parent meant to buy baby D drops, a vitamin D liquid. They mistakenly bought baby D drops probiotic. Fortunately, a healthcare provider noticed that the product bought by the parent did not contain any vitamin D. As pharmacy professionals, we all know when a baby does not get enough vitamin D, their bones may become softer and weaker than they should be. ISMP Canada shared this report with the D Drops company, who took the initiative to improve the safe use of their product. The image on the right is an updated package and label design shared by the company without the word D Drops. Our last example involves neuromuscular blocking agents, which are high alert drugs. This means errors with these medications can lead to significant patient harm, as these agents paralyze muscles, including those essential for breathing. Incorrect administration to a non-ventilated patient can result in respiratory arrest. A significant number of errors involve the inadvertent administration of a neuromuscular blocking agent when another drug was intended, with the reports detailing catastrophic outcomes. Following reports of substitution errors with neuromuscular blocking agents in Canada, both within the OR and other hospital areas, there was a collaborative initiative with industry and Health Canada to add a warning statement, paralyzing agent, to the metal ferrule and cap, and also the vial label. This work required involvement of all applicable industry suppliers for the various products. I do note on this slide as a reminder that an interim phase of any change management for improvement is always a tricky time and needs careful monitoring because some products will have the improvement and others won't, and healthcare providers might be relying on the improved packaging and labeling. We now have all neuromuscular products in Canada with the warning statement on the ferrule and cap or with a see-through cap. In the picture on the right, the row at the bottom shows the vials with their caps, and the row on the bottom shows the same vials and their metal ferrule. What are other ways that incident reporting can reduce or prevent harm? Well, here are a few more examples. ISMP Canada recently updated the Do Not Use list. This list of dangerous abbreviations, symbols, and dose designations considers reported harm, both actual and potential, and the frequency of use and/or the misinterpretation when communicating medication-related information. Organizations and healthcare providers are encouraged to adopt or adapt this evidence-informed list to meet the needs of information users in their own care environments. In the last slide, I mentioned high alert medications. Some of you may be familiar with this term. High alert medications are medications that bear a heightened risk of causing significant harm when they are used in error. ISMP Canada developed the evidence-informed Canadian High Alert Medication List through a multifactorial, multi-input process, which included contributions from patients, caregivers, and practitioners from many sectors and regions across Canada. And tall man lettering. As pharmacy professionals, you would likely agree that drug name confusion, particularly because of look-alike, sound-alike name attributes, can be a contributing factor to medication-related adverse events. Tall man lettering is a method of using uppercase lettering to sections of look-alike, sound-alike drug names as a way of differentiating medications. These are just a few tools that have been informed by the sharing of medication incident reports and near-miss reports. The goal is to help other healthcare providers from experiencing similar incidents with the ultimate goal of ensuring another client does not experience harm from medications. Visit ISMP Canada's website to explore assessment and analysis tools that could support your area of practice. Your shared learning contributes to resources like the medication safety self-assessments and courses on our e-learning platform, such as the safe use of insulin pens or medication safety considerations for compliance packaging. We also host live virtual workshops which teach participants how to conduct a multi-incident analysis or understanding how to advance continuous quality improvement in a community pharmacy setting with Lean Six Sigma principles as an example. All to say, ISMP Canada shares lessons learned through our various education offerings, tools, and resources. If you would like more information about ISMP Canada or reporting to the NIDR, please visit our website at the URL shown on this slide, or feel free to send your inquiry to either myself or our NIDR email address noted here. We look forward to hearing from you. Together with BC professionals, we can leverage learning provincially and nationally to advance medication safety and work towards zero preventable harm from medications. And I'm handing it back to you, Shifa.
Okay, thank you, Ina. So to help you prepare during the transition period, we've developed resources that are available now on our website at bcpharmacist.org/CIRCL. These include an overview of the program and key requirements, guidance on selecting a reporting platform, implementation steps, best practice guidance, and FAQs. We will continue adding and updating resources throughout the transition period, we are in the process of developing a quick start guide and role-specific guides for community practice, hospital practice, and pharmacy managers, which will be released through the transition period. All of these resources are there to support you and your team in putting new standards into practice. This is the first in a series of webinars to help you prepare for CIRCL. Our next session, Webinar 2, will be on November 20th, 2025, and will focus specifically on CIRCL standards and requirements for pharmacies. Then, in early 2026, we're planning to hold 2 more sessions. Webinar 3 in February, and Webinar 4 will be in April. Each webinar will build on the last, giving you more detail, practical guidance, and time to ask questions as we move closer to full implementation on June 1st, 2026. As we come to the end of this webinar, I'm going to bring us back to the beginning. One of our key messages for today's webinar was the why. Why are we doing this in BC? Why should you be as excited as me about doing this? So I'd like to share my why, which for me is linked with who, which then comes right back to me and why I chose this profession. For me, there are actually 2 who's. One is who is providing the care. And as pharmacy professionals, that's us, you and I. The other is who is receiving the care. And that is our community, our neighbors, our friends, and our families. For me, the people that you see on the screen, give me the answer for the why I'm excited about doing this. And I hope that this resonates with you as well. Thank you, Ina and ISMP Canada, for your partnership and collaboration. And Ina, for raising me up today, same as you did eons ago in school. Thank you, everyone who joined us today, for your time and attention. We look forward to sharing more information about CIRCL with you as we move closer to June 2026.